By the time you're considering shoulder replacement surgery as a treatment option for your shoulder pain that's caused by shoulder arthritis, you'll likely have seen your doctor or a physiotherapist who has advised you to speak to a specialist shoulder surgeon to further discuss shoulder replacement options. In this video, I'm going to explain what's involved in shoulder replacement surgery and at what point you might consider it as a treatment option, the different types of shoulder replacement, and what to expect in terms of recovery and the use of your shoulder following the procedure. I'm Rupen Dattani, specialist shoulder surgeon here at the Clementine Churchill Hospital in London, part of Circle Health Group, the largest private healthcare provider in the UK with over 50 hospitals across the country. Arthritis of the shoulder is far less common in comparison to arthritis of the hip or knee, but nonetheless it can be an equally debilitating problem that can have a significant impact on your life. It's worth mentioning that you don't always need surgery to relieve a damaged shoulder. Alternative ways of supporting any condition affecting the bone and the cartilage of the shoulder joint includes physiotherapy, having steroid injections with an added lubricant to smooth the movement of the joint, or simply taking pain relief medication and reducing any heavy lifting you're doing can be effective for some people's pain management in some situations. If this doesn't give you enough relief over time, then you do have the options of a shoulder replacement. Before we look at shoulder replacement surgery, it is useful to have an idea of the anatomy of a healthy shoulder and how it moves and functions. The shoulder is a complicated joint and is made up of three bones. The shoulder blade, known as the scapula, the upper arm bone, known as the humerus, and the collarbone, known as the clavicle. There are two joints within the shoulder. The main shoulder joint is formed when the head of the humerus bone fits into the shoulder blade. This joint is known as the glenohumeral joint and is a type of a ball and socket joint. Powerful muscles known as the rotator cuff muscles help to center the ball within the socket. The second joint is formed from the end of the collarbone and the protrusion of the shoulder blade known as the acromion. This is known as the acromioclavicular or AC joint and acts as a pivot when you raise your arm above your head. All joints are lined with smooth outer covering known as articular cartilage. With age or after an injury, this is where we start to see the articular cartilage wear away, become frayed and rough, and the protective space between the bones decreases. During movement, the bones of the joint may start to rub against each other, causing pain. We're able to see the extent of this damage using X-rays or more specialized tests such as an MRI or a CT scan to confirm the diagnosis, which you may or may not already have had done at this point. Arthritis can affect both the AC joint and the main ball and socket joint, though we can treat the smaller AC joint without the need for any replacement. Any activities that places excessive pressure on the AC joint may cause ACJ arthritis. This includes occupations which involve constant overhead lifting, such as in construction work, athletes who do a lot of overhead arm motions, or leisure activities such as weightlifting or bench pressing. In some contact sports such as rugby, there's a risk of falling onto the point of the shoulder, which can result in an ACJ dislocation, which in later life can cause arthritis. The most common symptom of ACJ arthritis is pain. The pain is often felt at the pointy part of the top of the shoulder joint and may radiate into the side of the neck and may become worse as the arm is brought across your chest. The pain is aggravated by overhead activities and lying on the affected side, and it may even disturb your sleep. The good news is you won't need a shoulder replacement to treat this joint. Pain relief medications and treatments like steroid injections I mentioned previously usually help. If pain persists, there is the option of having a small keyhole surgery, essentially to remove a few millimeters from the end of the collarbone to stop the bones rubbing together. So what about the main ball and socket joint? This is where we're looking at a potential shoulder replacement surgery. The pain you'd feel if you'd had arthritis in your main ball and socket joint is often felt at the back of the shoulder and will feel more like a deep ache. The pain is usually aggravated by movement and gradually gets worse over time. You may experience a grating or a crunching sensation when moving the arm. As the arthritis progresses, the pain will continue when you're at rest and may even begin to interfere with your sleep. The shoulder will gradually start to become stiff and the movements will start to become limited. So how is glenohumeral joint arthritis treated? When we find considerable damage in the glenohumeral joint, this is where you'll often consider surgery. There is the option to have a slightly less invasive keyhole surgery where the aim is to go in and tidy up the joint by removing any unwanted material within the joint and smoothing off the cartilage as much as possible. The results are hard to predict though, and you may need further surgery in the future. This is where a total joint replacement comes in. Just like a hip and knee replacement, it's incredibly effective and it quite literally replaces the damaged surfaces of the joint. In shoulder replacement surgery, the damaged bone and cartilage is removed and replaced with a prosthetic surface. This usually means that we remove the top of the humerus, the ball, and replace it with a metallic ball. Sometimes the ball is connected to a metal stem, which is inserted into the humerus. On the socket side, we use a plastic implant that is usually cemented into place. At the end of the procedure, there is an artificial ball and socket joint that moves smoothly, which means you will no longer feel the pain that's been caused by your bone rubbing against bone. This type of replacement is known as an anatomical shoulder replacement because the anatomy of the shoulder is restored back to how it should be. For this type of shoulder replacement to work, the main powerful muscles of the shoulder, known as the rotator cuff muscles, have to be intact so that they can stabilize and move the joint. The metal ball is therefore fixed to the socket and this plastic cup is fixed to the upper end of the humerus. With a reverse shoulder replacement, the structure of the shoulder is reversed so that the ball becomes the socket and the socket becomes the ball. The metallic ball is therefore fixed to the socket and the plastic cup is fixed to the upper end of the humerus. This type of replacement doesn't rely on the rotator cuff muscles to move the shoulder, but it engages a different muscle such as the big muscle on the outside of the arm, known as the deltoid, to move your arm in a similar way as your rotator cuff muscles would. You might be thinking, why not just go straight for a reverse shoulder replacement even if your rotator cuff is working? Well, that's a really good question. There are some surgeons who routinely perform reverse shoulder replacements in elderly patients with the view that their rotator cuff may deteriorate in the future, so this saves them revision surgery in the future. In fact, in the UK and USA, there are now more reverse shoulder replacements being performed than anatomical shoulder replacements. Both types of shoulder replacements are usually performed under a general anaesthetic, so all you'll remember is meeting your anaesthetist who will put you to sleep. Your anaesthetist will also use what's called a nerve block, which will give you very good pain relief for when you wake up from the operation. In some cases, the operation can be performed with the nerve block alone without the need for a general anaesthetic. With both types of shoulder replacements, you usually only need one night stay in hospital. During this time, your physiotherapy team will give you movements and exercises to keep your shoulder as mobile as possible and to prevent long-term stiffness. You'll be able to start moving the shoulder straight away, but for the first 6 weeks, it is important you do not do certain movements such as reaching behind your back, avoid brushing the back of your hair, or putting your arm out by your side. Your physio will explain the do's and don'ts in more detail and will be in constant contact with you in the first few weeks to make sure you feel supported and your recovery eventually gives you the pain relief you're after. After about 6 months of extensive physiotherapy, with your commitment and dedication to strengthen the shoulder again, you'll be back to playing tennis, swimming, or whatever it is your shoulder pain was stopping you from doing. Full recovery usually takes around a year if you're getting back into sports or anything beyond day-to-day use of your shoulder. If you're interested in a more detailed recovery timeline, we have another video on what to expect in the weeks, months, and up to a full year following your surgery, where we'll look at what point you'll be back to relatively being pain-free. So that was a brief run-through of the various treatment options for shoulder arthritis and a deeper look at the two types of shoulder replacement surgery you would consider if your shoulder damage has reached a certain point. If you want to come and see me for a consultation for specialist advice or to talk through any treatments covered in this video, you can book online via the link in the description below or search for your nearest Circle Health Group hospital and the next available consultant in your area at circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, or would like a video on what to expect with a different type of treatment, please comment below the video as we would love to hear from you. Otherwise, thank you for watching.